Hi, welcome to SkyLynn Mind Body Health. I'm your host, Ilynn. Today's topic will be shoulder instability. What is shoulder instability? If you're an athlete who does a lot of pitching, you're in softball, you're in baseball, or you have a job that requires a lot of overhead movement, sometimes these muscles get imbalanced. You have several muscles in this area. You have rotator cuffs, which is comprised of muscles. You have your chest muscles, as well as your shoulder blade back in here, your scapula, and the muscles that attach from the scapula to the vertebrae. So all this from here to here, from the pectoral girdle, is involved with shoulder movement. So anterior instability can happen, posterior instability can happen, anything can happen when any of these muscles are weak or some are out of balance. Some are contracting more, some are stretching more than what they should. So we need to get that all balanced out. So what are some in-home therapy exercises we can do? TheraBands is one that I recommend as a basic for my athletes. So to get started on the TheraBands, choose the color that best fits your level of strength. This is a gray, which is going to be kind of a heavy TheraBand, but if you're at home, you can start off with a red, work up to a green, and then to a black, and then a gray, and probably a gold, as the resistance get a little stronger as you move up the color wheel. So if you're at home and want to secure your TheraBand to a table, make sure that nut stays pretty secure so you don't pop yourself. Alright, so we're going to work on all ranges of motion for our shoulder to help get all those muscles back in balance and strong and help keep your shoulder, your humerus bone, from popping in and out of that shoulder girdle. So first exercise we're going to do, I'm going to make sure my hips are straight, I'm not locking out my knees, I'm comfortable, and I'm going to go into shoulder flexion. So all I'm doing is I'm making sure my thumb points forward, I'm stable, coming forward. I'm only going as high as my shoulder right here. If you're a beginner, start off at 15 reps and work up to 30 reps. So usually if you can hit 30 reps pretty easy on the color band, you can increase that resistance. So the next one I'm going to do is shoulder adduction, or adduction. So I have my resistance, I feel my resistance on the band, thumb is pointing forward, and I'm going to flex, pull my arm in towards my hip. So adduction, you can think of it as I'm adding my arm to my hip with resistance. So we want to make sure the only thing that moves is our arm at the shoulder. We don't want to incorrectly try to overcompensate by involving these other muscle groups. Try to keep your body nice and firm. Engage the core. And bring your hand towards your hip for adduction. Start at 15 reps and work up to 30 reps. Next one is going to be shoulder extension. So same thing, core's nice and strong. I feel the tension in the band, and I'm pulling my arm straight back to my hip, which is putting my shoulder into extension. From there, we're going to go into shoulder abduction, or abduction. So I'm starting at my midline now, we're at my hip, and I'm taking my arm away from my hip. So make sure you have plenty of good resistance. We're not going to go all the way up here. We just want to bring it out past our hip and feel that muscle engage the entire movement through. Thumb, same thing, thumb will face out. Common mistake is I see kids keep the thumb facing this way, and then they might bend at the elbow, and then they get their elbow involved and they engage other muscles. So make sure you keep your wrist nice and strong, you bring it out, and then we're engaging. Alright, 2 more exercises. If you're at home, have a pillow. This will come in handy, especially if you're a beginner at this. I'm going to show you with and without. So without it, we're going to do external rotation. So I'm bringing my shoulder out and away from my body. So I'm going to get that tension right here, right on my hip. I feel good tension, and as I bring it out, I'm engaging. I'm only coming to 90 degrees and back. So what happens if you're a beginner, your arm may come out and then you're doing other things you shouldn't be doing, incorrect mobility. So with the pillow, it's your mental reminder, keep your elbow in, flex 90 degrees, and that will keep your arm in and keep you from doing additional movements you shouldn't be doing. So that's external rotation. Next one is internal rotation. So now we're going to start outside, and we're going to come in with our arm. So we're going to bring our arm towards the midline. So I'm going to have good resistance on the band, and I'm going to bring it in towards my belly button. In towards the belly button. The only thing moving here is right here at the shoulder. My elbow is flexed 90 degrees, and I'm bringing it in. You can add the pillow for this one as a mental note. Mental reminder to keep your elbow in and bring it into the midline. What happens here sometimes is when I've seen people do this, they let their elbow come all the way out. So then they're doing this motion all the way in, all the way out, which that's not what we want. That's going to put too much pressure on that inside ligament for your elbow. And so we start here at 90 degrees and bring it in. And bring it in. Start at 15 reps, work up to 30 reps. So that covers your basic TheraBand with the TheraBand attached to an anchor. The next stuff we will do, because all those get your rotator cuff muscles. Rotator cuff muscles are infraspinatus, supraspinatus, teres minor, and subscapularis. A lot of the muscles, they all attach right in here. So we want to do some more strengthening of other muscles, such as the trapezius muscles and your rhomboids as well. So your trapezius muscles, this will get your upper traps. Make sure your shoulders are pulled back, sometimes incorrectly. Shoulders lean forward and you shrug up. This is incorrect. Make sure your chest is out, shoulders are back. You're shrugging up to your ears, all the way down. Same thing, shrug up to the ears, all the way down. Do 30 reps. Once you get your 30 here, we're going to move to our back muscles, the muscles in between our shoulder blades and our vertebrae. So we'll start off easy with some shoulder pinches. Elbows stay at 90, right here, palms are up. I may have minimal to zero tension right here, but I'm going to open up and squeeze those shoulder blades in the back. And this is going to help keep those muscles nice and strong in the back. Let me turn it around this way. I'm going to pinch, try to get those shoulder blades to kiss each other in the back. Engage those back muscles. If you get tired, you start making mistakes, or if the band's too loose, you might open up way too much, and your shoulders will begin to flare out, and it starts looking like this, which is incorrect. So we always want to have a good technique, good form. Stay right here, pinch the shoulder blades. Next, we're going to move into chest flies. It's the same thing, palms are up, core is engaged, minimal to zero tension right here. And I'm going to squeeze my shoulder blades in the back, bring it open. Squeeze my shoulder blades in the back, bring it open. Just make sure you don't lock the knees up. If you need to offset your stance, that's quite fine. Just make sure your core is engaged. And the only thing moving is at the arms. And you're pinching. Pinch them shoulder blades together. And back. Start at 15 reps. Work up to 30. Common mistake here, the band's too loose. And what ends up happening is it looks like this. And you're not paying attention to what you're doing. It's not a good quality workout. Make sure you have a good resistance, a good band, and it's a sustained movement all the way through. All right, that gets you strengthened. That gets all that shoulder complex to help with any type of shoulder instability. And then, of course, we also want to stretch it out. So we've done all the basic stretches. Bring the arm across the chest, hold for 30 seconds. In this case, you can do both arms if you did both sides. Bring the arm above the head. Hold that stretch for 30 seconds. And then probably some new ones you haven't seen before or don't do too often. Arms are going to relax to my side. I'm going to drive my fingers towards the ground. And with my head, I'm going to drop my ear to my shoulder. And I'm going to hold that for about 30 seconds. If I want, I can do my other side. 30-second hold. Next one, I'm going to drop my ear down towards my shoulder and then drop my chin towards my armpit. Hold that for 30 seconds. Back to center. Let's do the other side. Drop my ear towards my shoulder. Look down towards my armpit. And then the last one, when I drop my ear down towards my shoulder, I'm going to look up towards the light. Get some breaths in as a workout. Switch sides, drop my ear down towards my shoulder, and then look up. Hold for about 30 seconds. Repeat those 3 times each. And then you've stretched out those muscles you just worked out. Thanks for watching, guys. Remember to please subscribe, like, and leave any comments. See you next time.